Hello and welcome to the next episode of the Explain series, and I'm your host, Dr. Bret Palmer. In the Explain series we take a sexual health topic and explain it, and this week it's the turn of PID. Now you may have heard of what PID is, but what does it stand for? It stands for Pelvic Inflammatory Disease, and it's a clinical diagnosis. That means there's no test, there's no blood test, there's no swab you can do for it. It is a diagnosis that a doctor makes when you go to them, and they'll have to examine you, and after the examination they will then decide whether you have pelvic inflammatory disease or not. So what is pelvic inflammatory disease? Well, it's inflammation of the uterus or the fallopian tubes or even the ovaries. And so what's usually happened is a bacteria has been pushed into the uterus, usually because of sex, because obviously in sex there's lots of pushing and shoving and exchanging of fluids, and that sometimes means harmless bacteria has got into the uterus. Okay, and the uterus is effectively the womb, and it's like the shape of an upside down pear just underneath your belly button effectively. So this is obviously something that only affects women. An infection, when it goes into the uterus, can track along the ovaries and then can track along the fallopian tubes and then also infect the ovaries. And so you can have generally a lower abdominal pain. It can be very, very painful. So in the most severe cases, people won't even be able to walk. But usually people see medical advice before it gets that bad. What are the other symptoms? Pain on sex, but instead of like thrush, where it is pain just on the surface of the vagina, the pain can be very, very deep within. And what's happening is, as the penis is hitting the cervix, it's causing the womb to move, and every time you get that slight movement, that's causing a little bit of pain to be felt by the individual. Now the pain can be very, very disabling, and I don't want to in any way undermine it. And so if you are getting lower abdominal pain, you must see your family doctor, or better still, go and see your sexual health doctor at the local sexual health clinic. You may also get a little bit of pain on peeing, and you also may get a strange discharge as well. So is PID a sexually transmitted infection? Well, you can read lots of scientific papers on this, and PID can be caused by sexually transmitted infections, but depending on what papers you read will give you a different amount. But as a general rule, if you're female and under 25, then 30% approximately, some papers give up to 50 or even 60%, can be caused by chlamydia, for example, or even gonorrhea. That means, if you're using the 30% figure, that means 70% are caused by some harmless bacteria that's just got into the uterus or the fallopian tubes. If you're over 25, then the figures are slightly different, and they drop down a bit, down to around about 25% are caused by chlamydia. That means 75% are caused by some other bacteria that's been pushed and shoved into the uterus, usually during sex. As people who suffer from PID usually are sexually active, we do treat PID as if it is a sexually transmitted infection. And so if you're treated for pelvic inflammatory disease, it doesn't mean you have a sexually transmitted infection, but your partner should ideally be treated as well, because if there is a harmless bacteria that's just got into the wrong place at the wrong time, then your partner could re-inoculate or replace that infection next time you have sex. And so obviously don't have sex while you're on treatment, and the treatment can actually vary considerably. The treatment is usually about 2 weeks long, usually involves the antibiotic doxycycline and metronidazole, and can sometimes, if it's very severe, you can also get an injection as well of antibiotic called ceftriaxone. I'm not going to go on about the doses and how to take those, because the doctor, if he's diagnosed it, will go through how to take those particular types of antibiotic. So that's the general treatment. How do you avoid it? Well, PID is very, very difficult because obviously it's a mechanical process where bacteria has been shoved into the uterus, and so you should go to the doctors, go for an examination, and they will do something called a bimanual examination, and that's where they place 1 or 2 fingers into the vagina and another hand on the outside to try and move the cervix around. Okay, and if that is particularly painful as they're moving the cervix, that will be evidence for pelvic inflammatory disease. They'll also take a few swabs and look under the microscope for that. And if it's got white blood cells on the microscope, in other words, also called pus cells, then unfortunately you will be treated for pelvic inflammatory disease. Some people do get it again, but it's important to get treated quickly, because pelvic inflammatory disease can affect fertility in later life, and the longer you have it and the longer it goes untreated, the higher the chances of having damaged fertility. In terms of prevention, well, use condoms. That's always the best way. There is a sizable percentage that is caused by sexually transmitted infections like chlamydia or gonorrhea. Let's just say it's around about 30 or 40%, and that could obviously be prevented if you use condoms. So don't wait up, get a sexual health screen, go and get checked out, and if you're in pain, go straight to the sexual health clinic. So if you like this video, please like, subscribe and share please, and I'll see you next week for the next video. And you can get more information, by the way, at the CDC website, NHS Choices websites, and also the Family Planning Association, as well as the British Association of Sexual Health and HIV. Take care and have great sexual health. Bye-bye.